We're joined by Dr. Elizabeth Lee Vliet, a preventative medicine specialist and former director of the Association of American Physicians and Surgeons. Dr. Vliet, thank you so much for being with us today here on America's Forum.
Well, it's good to be back with you, JD, after all of your work and times of working with you in Arizona, so it's nice to hear your voice again.
Well, Elizabeth, it is a joy to have you on, although this subject is pretty scary to a lot of people. What can you tell us? Are you getting any more information on the condition of the two Americans?
No, that has, other than what is officially released, I don't have any inside information back in Atlanta from out here in Arizona. I tell you, JD, one of the things that is a bigger concern to those of us at Ground Zero in Arizona and Texas, where I have medical practices, is the fact that the flood of illegals coming across the border are coming from 75 countries around the world, including countries like the three in which the Ebola outbreak has taken place. There was just a confidential border report released yesterday that indicated that 71 individuals from the three nations affected by the current Ebola outbreak have either turned themselves in or been caught attempting to illegally enter the U.S. between January and July this year. So we know from the Border Patrol sources that have been courageous in getting information under the suppressed umbrella, getting it out to the public, that we have individuals from China, Pakistan, Somalia, Yemen, and the Middle East, as well as Central and South America.
And again, Doctor, the thing we need to stress is some of those people are coming in, and again, it's important to take note, get some perspective. Not every illegal coming into the United States is from Mexico or Central America, although that remains in the news. You mentioned 75 other nations, including those who have been dealing with the Ebola virus. Thus far, no one, as we understand, has crossed the border with it, but obviously there is concern about it. Now, I just have to ask you a question about Ebola and its survival rate, what we are seeing on a public health basis. What is the survival rate for those who have been afflicted, those humans who've had Ebola thus far?
Well, the survival rate is reported between 50 and 90%, actually death rate. So it has a very low survival rate. In the current outbreak in West Africa, over 800 people out of 1,200 affected have died. And what we've also seen, which is even more alarming, is that more than 100 medical professionals treating the patients have been infected with the virus. That suggests that even those people taking extreme precautions are still at risk, because the medical people caring for the patients in West Africa are using the precautions that we've been told are effective. And my concern is that studies from Canada suggest that we may be too premature in saying that there is no aerosol or airborne transmission. What the Canadian studies have shown is that it's suspected that there may be, but we don't know. There's a lot we don't know about this particular virus. And so to categorically say there is no airborne transmission when the medical professionals treating patients in West Africa are becoming ill in spite of using the precautions, it raises red flags. Personally, I had medical concerns about bringing the two patients from Africa back to the U.S. I think it made more sense from a cost benefit as well as a medical risk to keep the patients there and treat them with the mobile units that we have available.
Doctor, let's talk about this experimental drug, I believe called ZAMPP. Could you tell us about this, especially given the fact that Americans are going to be asking what, if anything, is out there to cure this?
Well, there hasn't been much released about that experimental drug. You have to understand that the information on this illness, on the prevalence of disease in the illegal population, as well as the status of the West African situation, has not been addressed in the press in the United States. Much of the information I have on the West Africa situation comes from the international press and the World Health Organization. And so you have to understand, those of us in practice, we've been trying to get information from the Arizona public health officials, and they simply aren't given information either, or they've been given the same talking points. There's nothing to worry about. And yet we just had 89 patients in New Mexico identified with tuberculosis at the center that was quarantined. What was announced to the press and to the public was, oh, we're quarantining the New Mexico center because there are 2 cases of chickenpox. Well, that's a significant distortion in the medical risk.
And this is something
how we present it to the public.
We need to amplify this, Elizabeth, because we began the discussion, you discussing your frustrations about public health and the border, making sure people understand that there are people coming from those African nations where Ebola has struck with a vengeance. And what you seem to be telling us is, in terms of public health, just hearing from the CDC and other sources in the United States and elsewhere, keep calm, there's nothing to worry about. Sounds to me, Elizabeth, both as a citizen and a doctor, you're pretty concerned.
Well, I'm very concerned. We've already had Border Patrol agents infected with tuberculosis, swine flu, lice, scabies, chickenpox, and they've carried these diseases home to their families because they didn't know they had them. We've had the Inspector General's report from the Department of Homeland Security was just quietly released at night on July 31st. I've looked at a copy of that report. The Department of Homeland Security employees have also been identified with these diseases and their children infected. So yes, there's a much bigger picture here than what the public is being told. The children, the young children that are coming across the border, which is less than 10% of the illegal border crossers, 83% of the illegal border crossers are young males 14 to over 19 years old. So it's an entirely different population out here that the Border Patrol people are seeing from what's being reported in the press. Those of school age are being dispersed across the country. They are being put into the public schools, and many communities are not told. You've heard reports of mayors and governors who suddenly find that under cover of night, a plane load of these illegal border crossers has been brought into their state or their community without their knowledge or permission. I think this is a medical public health risk to the communities that are unsuspecting, and that's one reason I've been working on this and writing and speaking about it since early June.
Elizabeth, we just saw file footage of the CDC, but it sounds to me, if you were going to rank the public health risks in the United States right now, number one in your mind would be what's coming across the border right now, and then number two, all the publicity about Ebola. Do I have that right? Is that what I'm hearing from you?
Well, the what has been coming across the border, not right now, but going back 6 months, is a much greater, broader public health risk than the 2 Ebola patients who were properly transported, as far as I can tell. I mean, all we have are the TV reports. But my point is, those were 2 Ebola patients that everyone confirmed from the CDC that the proper precautions were being taken. The illegal border crossers that have been flooding Texas and Arizona going back months now are the ones that are not medically screened. They are quickly dispersed into the communities. They're not being deported. They're being taken to communities all over the country. So these are bigger public health risks. There are more of them. There are more variety of infectious diseases, and they're not being addressed. So yes, that is a bigger issue.
We appreciate you addressing it, Dr. Elizabeth Lee Vliet. Thank you so much for your time and your knowledge of public health and the issues that are confronting us in terms of public policy. America's Forum will continue right after this timeout.